The coroner's inquest into the death of Samwel Uko is putting mental health treatment in our province under the microscope. Dave Nelson from the Canadian Mental Health Association will testify at the inquest later this week, but he's speaking with us today from Regina. Thanks for joining us, Dave.
Oh, good to be here.
So you've seen the video of Samwel Uko being hauled out of the emergency room screaming that he has mental health problems. What goes through your mind when you watch that?
Well, I think most people would find that very, very disturbing. We don't see the hauling out part that often, but what we see is many people having a very difficult time getting timely help for psychiatric services and assessments and so on, going to emergency rooms. They were never designed for non-medical psychiatric emergencies. And the good news is that there's a model that we've presented to government, and we're hoping that government will place in the 2 urgent care centers in the province in Regina and Saskatoon.
All right, we'll talk a little bit about that in a minute. But first, I want to talk a little bit about the inquest and how that's going to focus on the gaps in treatment. What are some areas where you think improvements can be made in our system?
Well, I believe that we need to have dedicated pathways for people who have psychiatric issues that is not through emergency rooms. They are there specifically, almost exclusively for physical care, not psychiatric care. We need to have 24/7 capabilities with packed like police and a mental health worker, because many of these issues happen at 2 a.m. They don't happen in regular hours. We should have 24/7 coverage with nurse practitioners throughout the night and through the day. And most importantly, we should have brief treatment available in a very timely way. And then we should have psychiatric social workers that can set up people with community resources after they come out of that urgent care center.
You've mentioned the urgent care centers in Regina and Saskatoon that the province is building to ease pressure on emergency departments and to provide those mental health services. What other potential do you see in those centers?
Well, I mean, I believe that what will happen is there will be a pathway there that is much less frantic than emergency rooms are. It will be much more timely. It will be, specifically for dealing with a person with a psychiatric emergency. Right now, people can wait from 5, 6, 7 hours to be able to see somebody in an emergency. And I have been there many times myself supporting somebody, and it's not easy. And that's for me not to be easy, but for the person who might be paranoid or suffering from depression or anxiety or psychosis, it's almost unbearable. And many people just leave.
Dave, if I were to know someone, or people watching were to know someone who is in mental health distress, what should we do?
Well, I think that what we should do is encourage them currently to go see their family doctor. If it's an emergency and someone is having suicidal ideation, they should go to emergency. Probably, if you can, they or someone, yourself, a family member should go with them, sort of for support. Going into that situation on your own is very, very bad. It's hard enough if you've got somebody with you to support you in that, right? So I guess it really depends on the urgency of the situation, right?
Ultimately, Dave, what do you hope will come out of the Uko inquest?
Well, what we're hoping is that, and there's good hope with this, that the urgent care centers will be adequately staffed and completely staffed with the model that we've presented to the minister and to the health authority to ensure that people have a much different, easier, more timely pathway to get psychiatric emergencies done. There's still a place for the medical emergency in the emergency unit. For instance, if somebody is having has taken a bottle of pills and they need to have that addressed immediately, that's what emergency should be for. But most people really require to have a better pathway.
Well, Dave, thank you so much for your time today.
All right, thank you.